Hello, good morning, Professor Sonis. Good to have you here with us in SOBEP Online. Can you hear me?
Yes, I can.
Okay, perfect. Thank you so much for your great lecture. It was amazing. In your lecture, you brought up the possibility of treatments and was amazing. All of this based in very high quality evidence based. But I have some questions for you. We don't have any questions from the audience until now, but I have two questions for you, more related with pathobiology of the oral mucositis, because I think that the understanding of this is very important to us to bring new treatments and to try to understand a little bit more of the behavior of toxicities. So, genetic factors are found to affect individual susceptibility towards radiation or chemotherapy-induced adverse effects. In your opinion, how far we are from the use of genetics analysis in the routine of cancer patients, not only for oral mucositis, but for the toxicity in general, or for planning the treatment for each patient?
Right, so it's a great question because it falls into the realm of precision medicine, and it also recognizes that toxicities happen in clusters. So I think, with the Human Genome Project, as I mentioned in the talk, the assumption was that that was going to be a biological epiphany. It was going to answer a ton of questions. And actually, what happens is certainly genomics plays a role, but it's only a portion of the total factors, biological factors that predict risk. So as I mentioned in the talk, to ignore the transcriptome, the microbiome, the phenome, the environment, all of those things as a composite impact risk. And what's interesting is they're not equivalent. So whereas genomics might be the predominant driver of risk in one individual, it may not be the predominant driver in another. So we're looking now at being able to integrate all of those outcomes using machine learning, coming up with neural networks, and it's an opportunity actually for the application of AI in doing this. So I think it's still very much an ongoing, project.
Perfect. In thinking about of other important points in pathobiology of oral mucositis, I would like to hear more from you about the how do you see the role of microbiome in the development severity of oral mucositis?
Yeah, so I would say it's unresolved. So one of the things that we know is mucositis is not an infectious disease, right? And if you look at the application of probiotics, either internally or orally, you look at the starting microflora in patients who develop mucositis and those who don't. There's a huge variability. So there's no question in my mind that the microbiome plays a role in either accelerating or extending or affecting the severity of mucositis. But I think we just don't know what that is. And yeah, so it needs a lot more work before we really understand things. So
I totally agree, and for sure, oral mucositis is a huge field for research because it's so complex, and we have different type of patients, different type of drugs, different type of other factors that could interact. But to finish our talk today, I would like to ask one more question. What fascinates you in oral mucositis? because you are our guy in oral mucositis in the world. You are the person that leads us to study more. What fascinates you more in work with patients with this?
So I think it's still a gigantic unmet need. I think, for patients, it's a big, big problem. As you point out, it doesn't happen in isolation. And it's also because we're starting with patients that are essentially healthy and then giving them either radiation or chemotherapy. And I would extend this to targeted therapies, immunotherapies. And then we create a pathology, whether it's conventional mucositis or stomatitis associated with mTOR inhibitors or whatever it is. It allows us to model for other diseases, because once we understand the biology, for example, of immunotherapy, and you look at the side effects, the oral mucosal side effects of it, they mimic a lot of the blistering diseases, lichen planus. And so aside from being its own entity, studying mucositis basically opens up and explains the opportunity to explain what's going on at the biological or the cellular level, the tissue level of other diseases. So it's very, very broadly informative. That's what's fascinating about it to me. And it keeps changing. So anyway, thank you again for having me.
Thank you, Professor Sonis, for being with us in this moment so special for SOBEP. And we really, really hope that we can have you here in Brazil in person soon as possible. Thank you so much for everything that you have been doing.
Right, and congratulations to all of you for this. Bye-bye.
Bye-bye. Thank you so much.